Good morning, everyone. My name is Carrie Hutchinson. I'm a Health Communications Coordinator with Public Health, and I will be hosting today's briefing. Today is Friday, October 23rd, and we will have a brief update from Dr. Hsiu-Li Wang about COVID-19 in our community. With that, I will pass it off to Dr. Wang.
Thanks, Carrie. So good morning. In Waterloo Region, our case rates and other indicators remain fairly stable. COVID rates, however, can quickly escalate, so we need to maintain our diligence, physical distancing, wearing a mask, staying at home when sick, and limiting close, unprotected contact with others need to continue to be a part of our new normal. I'd like to say a few words about team sports. Following the release of my general guidance for fitness and sports activities earlier this week, we have heard about more outbreaks elsewhere in Ontario in team sport settings. For all settings, I'm advising the following general principles. Limit close contact to only your immediate household members. Practice physical distancing and wear a mask or face covering with everyone else. Outdoors is safer than indoors. Play outdoors when you can. And finally, stick to smaller groups. Smaller is safer. More specifically, with respect to team sports, based on the risks seen in outbreaks that have occurred, we are encouraging all sports associations, including organizations or recreational groups, to 1, minimize social gatherings of participants and spectators both before and after the activity. It is often in the pre- and post-play settings where spread among players in families have been reported. 2, avoid carpooling with those outside your household. If possible, don't carpool with those outside of your immediate family. If you need to carpool, limit the number of occupants in the vehicle, open the windows to create airflow, and ensure that everyone in the vehicle is wearing a face covering if they are not from your immediate household. 3, do not share equipment or gear. 4, participate on only one team. And 5, play outside when possible. These measures, in addition to all the other measures that organizers are required to implement for a return to play in stage 3, will help reduce risk of transmission in team sports settings. Public Health is actively reaching out to the local sports associations with the help and support of our area municipalities to ensure that they are aware of the risks, that the required measures are in place, and that players, staff, and families are reminded of the importance of following public health precautions at all times, that is, before, during, and after play. In closing, based on where we started in September, we could have been in a much worse situation now. By working together as a community, we have slowed the spread of COVID-19 and reduced the risks for vulnerable settings and for schools. We have helped businesses stay open, and we have allowed medical procedures and surgeries to continue. Let's keep working together. By supporting each other and helping to protect one another, we are also building the strength and resilience of our community during these challenging times. Thank you very much. Okay.
Thank you, Dr. Wong. So we will turn it over to questions, and we will start with Tim from 570.
Thank you. Dr. Wong, London Middlesex announced additional restrictions for the region by its own medical officer of health. Are we going to see something similar locally, or will we continue to follow direction from the province?
We are going to continue to closely monitor the situation in our region. Right now, our rates have stabilized. That's a good sign, but as we know, things can change quickly. And so we're closely monitoring that. There's always a balance that we have to try to achieve, and that was always the objective for wave 2 and beyond, because we know that COVID will be with us for some time, to try and keep settings opened as much as possible while reducing risks overall to our community. So we have to, always consider that balance. And, if the situation changes in the region, or we're seeing very specific risks in a particular setting, then there may be additional measures that are put in place in any area in Ontario, including ours.
Okay. And last week we talked a lot about workplaces and employees. And but I was just wondering about the fast food industry, especially when there's a lot of people, a lot of workers in close contact with one another, especially waiting in line or at cashes with no relative distancing. What do you think about that?
Yeah, so we all have a part to play. The employers, the employees, and the patrons. We all need to play our part in terms of distancing, wearing masks, washing our hands, and staying home if we're sick. What we have noticed overall in work settings, including settings that serve the public, is that the employers and employees are taking good precautions to prevent exposure from employee to patron in general. And there's a lot of work in that area. Where we're seeing sometimes not consistent adherence to public health recommendations is when it's employee-only areas. So that's what I had mentioned previously, that's an area of risk that we've seen. And so that's basically why I wanted to highlight that, so that everyone is reminded that it's important that we continue to take those precautions even when there are no patrons around. And I'm continuing to emphasize that where I can. So thank you for the question. We just have to continue to keep those measures up everywhere.
And I noticed that there's a place of worship identified as an outbreak. Is there a reason why it's not named?
Yeah, we generally do not name individual facilities or workplaces unless we think there's a risk to the general public, or there is a need for us to ask the general public to self-identify as contacts that we need to get in touch with. So in this particular situation, it was an event that was held at the place of worship, and public health, working together with the facility management, is able to determine who are the contacts that we need to get into contact with. And so, the purpose really is to make sure that those who need to know, those who could be at risk, are contacted.
That's it for me for now. Thank you very much.
Okay, thank you, Tim. For our next questions, we'll move to Irene from Air News.
Hi, Irene.
Hi, Dr. Wang. I was wondering about the notice that we got about the statistic reporting, that it's now going to be on Monday afternoon. And of course, that misses the Air News deadline, but is there also reporting on Sunday?
Yeah, there's reporting 7 days a week now. So
okay.
every day, it will be at 1:30. And the advantage is that now we're going to be reporting from midnight to midnight. So that's going to cut down on the number of times we have to add cases to previous days, the previous day's count. That's because of the new provincial system. Before, we used to get batches of reports, and we could sort of determine, after a certain hour, there'd be less coming in. But now with the new provincial system that almost all health units are on, it comes in at all hours of the night. So even if we stop reporting at 5, like we used to, it keeps coming in throughout the night, and then the numbers have to keep, we've noticed that, and I'm sure it's been not that great for the press who are trying to get a handle on daily reports. So that's the reason, but now there'll be 7 days.
Is there a
weekly trend, really? Yeah, sorry, go ahead.
Sorry. Is there a provincial, is the regional information being fed from a provincial source that we could access?
Yeah, there's daily numbers that are put out by the province, but they have different cutoff times too, right? So that is why the provincial numbers on a daily basis don't necessarily match up with the public health unit numbers on a daily basis, because each public health unit can choose sort of, when they report, and then the province will pull at a certain time based on, when they'll pull. But overall, I think the important thing is to take a look at the trend over a longer period, like, for example, a weekly basis, which is why every Tuesday, as part of my update, I'm going to present a little bit more stats to give a sense of what the weekly trend has been like.
Okay, well, that's good to know. We're a weekly, so that works in with what we've been doing. Great, thank you. That's it.
Thank you, Irene. Our next set of questions will go to Paula from CBC.
Hi, Paula.
Hey, I was wondering, given the recent, fairly high number of cases among younger people in their 20s, if you are doing anything now, or if you have anything in the works to, really target the young demographic with, these public health measures we all need to be taking.
Yeah, actually, it's something that our communications team is working on. And I know the province is also working on this because, we have to try to maximize the uptake, so to speak, of the recommendations among the younger generation. So, it's an issue that currently our communications team, as well as the provincial one, is working on.
Any plans for like a TikTok or anything like that in particular you can share?
Is there anything you want to say about that?
Yeah, I'll jump in. So I think what we're looking to do is that we know that there's a certain level of fatigue. The messaging we have is universal. It doesn't vary from age group or setting. So what we're working towards is trying to acknowledge that fatigue, but also giving people the tools and the information they know, the information that they need so that they can keep moving forward. So framing things in the positive, not focusing on the things that they can't do, but focusing on the things that they can do, which we know is an effective way to communicate to younger adults as well as the general population. In terms of platforms, I can't commit to us to creating a TikTok account, but we're certainly looking at different ways to engage with younger audiences in a targeted way.
Okay.
Thanks.
And my colleague Kate Bickert had a story the other day about the case total this month, that we're now looking at over 300 cases in October. The last time we topped 300, I believe, was in May. What do you take away from those numbers?
Well, what I take away is that I'm really glad that right now anyone who needs a test can be tested. So the testing eligibility has been open to a lot more people than it was even back in May. And, it was only towards the end of May, I believe, that testing was opened up more broadly to the general public. And it's still opened up to the public in the sense that anyone that is recommended to get a test can get a test. And so I think, that's probably a large reason why the numbers in the first wave were not as high as they likely should have been, because we didn't have broadly available testing for those that needed it. And so it's good now that we do. And I think going forward, it's going to help us to better monitor the growth or stabilization of cases in a community. I would say that sorry, this is my train of thought there. I'll just leave it there. You can let me know if you have other questions.
Just briefly as well, setting aside the name of that place of worship, can you give any information about the type of that event, whether it was a wedding or something else?
Yeah, it was a personal social gathering, and they can be for various reasons. But I think the reason we wanted to post it, and the reason that we wanted people to be aware, is that these are the types of events that not only locally but provincially we are seeing spread in when there are privately organized social events, and there are a lot of people. There can be spread, and so that it reinforces the importance of anyone organizing or going to one of these events, following the recommended public health precautions, and reinforcing that as much as possible with all attendees.
Okay, thank you.
Thank you, Paula. For our next set of questions, we'll go to Nicole at CTV.
Hi, good morning, Dr. Wong. Has the region put in a request for any of the rapid tests announced by the province yesterday and this morning during a media briefing? If so, for what facilities in the region can we expect the rapid testing to be done at?
Yeah, that's not something that's asked for or decided really at a public health unit level. This is more something that at this point in time, at least, is being determined at the provincial level, in consultation with experts who can advise the government on, the pros and cons of the different types of testing available, and therefore in what circumstances or situations those types of tests would best be used. So people sometimes have this impression that a rapid test means, oh, we can just get a test and it will tell us right away if we have COVID or not. Unfortunately, we're not in a stage where this type of testing is widely available, nor is it, because of its limitations, nor is it recommended generally broadly for people. So we still have a gold standard test, the PCR test, and we have the assessment centers that I continue to recommend people use whenever they have symptoms that may be COVID, or they've been advised to get tested. For now, that's where people need to go to for testing. And with these new technologies, which will not be in broad supply, at least at first, there's going to have to be provincial level decisions about, where it would be best placed to put them. So for example, I know that it's been announced, or not announced, but it's been discussed publicly that they're looking at places where it's a very remote area, and it's maybe difficult for people to get a test because, well, in a sense, difficult for maybe not to get a test, but for the testing to be routed and then the testing to come back in a reasonable time frame. So things like that. But I'm sure this is a rapidly evolving field, so I'm sure we'll learn more. You will likely learn at the same time as I will. And so we'll keep monitoring that. And if there are indications locally, of course, we would have input into that.
Earlier this week, the dinosaur drive-through event through the museum and Bingaman's, they're saying that they've had tremendous success. Bookings have surpassed 30,000, with more than 30% from out of the region. That's roughly 10,000 people potentially from GTA and other hotspots, coming to the area, potentially going to restaurants because our restaurants are open, unlike those areas, potentially getting gas. What concerns do you have in regards to this when the province has asked people not to travel really between jurisdictions?
Yeah, I would just, I think, emphasize that people that are in areas of where there's widespread transmission and they've been put under additional restrictions for the time being, they're being asked not to leave their areas, and that's the advice that that's the advice to across the province. We do have to rely on people listening to the guidance. It's something that's not recommended for those people at this time, that they travel outside of their region. Regardless, if people are in our region, they need to adhere to all the requirements that are here, and the basic requirements of limiting close contact to only those in their immediate family and distancing and masking with everyone else.
Would you then say anyone coming from outside Waterloo Region don't attend the dinosaur drive-through?
Well, they shouldn't be coming to the region if they're from one of those areas where they've been asked not to leave. So that's the message. They shouldn't be coming here, regardless of where they're going.
Okay, would you put in a request then for the facility holding the event to perhaps put out that request to any of those visitors that have potentially already booked?
I think right now there are the restrictions that are in place for the different regions in Ontario, and I'm going to ask people to respect those restrictions. And if they're in an area that is under restrictions and they've been asked not to leave their regions, that they do so.
That's it. Thank you.
Thank you.
Thank you, Nicole. For our next set of questions, we'll go to Joanna at the Waterloo Region Record.
Thank you. Dr. Wong, one question to start. In recent days, you've talked about kind of a relaxed approach in certain settings, like employee-only areas at workplaces, or now you just talked about team sports, and there's this outbreak at a church gathering. It seems like more and more in sort of social settings, people are engaging in risky behaviors. And I guess, what do you attribute that to? And is that worrisome for you? Because, we have this outbreak at this church gathering and just more cases, and also a greater risk that it'll be spread to other people in those settings.
Yeah, that's a great question. So I think that's basically what we've been seeing since the beginning of the second wave in Ontario and here locally as well. We've been seeing that general relaxation, especially in social settings. But, also in other settings, perhaps where people are more familiar with each other, like colleagues at work. I would say that, because we've had more cases now and we're able to see more of the trends, these are the types of common risks that we've seen. And that's why more recently I've been highlighting them, because they become more clear over time. I do think that it is human nature for us to, want to socialize and enjoy socializing, and that the restrictions, that we were under in wave 1 were difficult. And then as we were able to lift restrictions over the summer, people were able to enjoy more freedoms. And so they, I think it was hard for them to perhaps stick to the public health recommendations when they saw so many other people as well socializing. And so, that's the difficult balance that we have to maintain. We want to try to not have as many restrictions so that people, can socialize safely, so they can work safely, so that they can do physical activity and sport safely. But in order for us to do that and not be in a situation where we have to put in additional restrictions, we have to limit the types of things that they can do even further, everyone needs to continue to follow those general, 4 principles that I outlined. And I think it's human nature, and it's not easy for people sometimes to, it's just to sort of understand or be aware that they have to keep those things up because they're seeing more activity around them. And so, part of my job, I think, is, even though I feel like, maybe I'm boring because I keep repeating the same things, I think what I'm trying to do is make it, reinforce the messaging, trying to simplify the messaging where I can, so that people can remember the general principles and, use them for all different settings. So I do think it's something where, it's part of human nature, and just based on, the cases that we followed up with and the stories that I've heard, by and large, people want to do the right thing. They really want to do the right thing. Sometimes they're confused. Sometimes they know they haven't done the right thing, but it's because they wanted to, they didn't really want to keep up with the precautions anymore. Like Carrie mentioned, the pandemic fatigue. And so I guess just to close it off and to, sort of end with something, this is what we have to continue to do in order to be able to not have to put in further restrictions. So what I'm encouraging everyone to do is try to make these things as much of a new normal for us as we can, right? Understand that these that the COVID-19 and the risk of spread of COVID-19 is going to be with us for some time, but we have been able to, and we can continue to reduce the risk of transmission through the things that we've done. And by doing that, we can avoid, to the extent possible, any additional restrictions so that people can continue to, lead activities as normally as possible. So it's that fine balance that we have to continue to meet, and it's going to be a long haul. And so, just want people to understand that when we as a community continue to do that and continue to be diligent, diligent, there, we can keep rates of spread manageable, and we can continue to lead activities as normally as possible.
And so what would your message be then to people who sort of have like an individual approach and think, well, it's just me doing this, or also, I've done this in the past. So like, what's the point of, being more strict about following the rules now?
Yeah, I think what, I would say is we've seen the power of community actions, right? We've seen how powerful they can be when we think about the fact that everything we do, it affects not only us, but it affects, our friends, our family, our neighbors. And it's maybe a difficult concept for people to grasp if they haven't been affected personally. But we see that on a population level, and we also hear that from the stories that we hear about. There have been cases, who have gotten the illness and then have said, oh, and then they have spread it to their family and friends. They're like, oh, well, I didn't think that, I didn't think it was that risky. I knew, that I wasn't really supposed to do that, but I thought it was okay because I'm a healthy person. And so they don't necessarily, I don't think it's ill intent. I think it's people don't necessarily think about that. But I think in the time of COVID, this is why, we're sort of emphasizing that everything that we do individually, it really adds up. And, we have unfortunately seen in Ontario's communities where it continues to spread, and it's very difficult to control. And, and so in our community to date, we've been actually able to slow the spread. We saw a rapidly escalating trend in September. And then, people double down on the measures, and then we're seeing a stabilization, which we hope will continue. So I can just say, I would just say that everything that, in these COVID times, everything that we do individually has a significant effect on all of us.
Okay, thank you.
Thanks. I hope you're feeling better.
I'm feeling okay, considering.
Okay.
Thank you, Joanna. We will go to Damon from the Woolwich Observer for our next set of questions.
Hello. So my first question, I was just looking for more information on this place of worship outbreak. I was wondering if the gathering was held inside or outside, and if public health measures were being followed.
Yeah, so, it was an indoor gathering. And I think, again, it highlights the risks when, there isn't diligence at all times for distancing and for the wearing of face coverings. So I think, again, it's actually a common thing we've seen across the province now, and including in this outbreak. So it's a reminder of the importance of, even when you're in gatherings with people that you know and are familiar with, if you are gathering with people outside of your immediate household, you need to maintain physical distancing and then the wearing of face coverings at all times with everyone else.
Okay, and could you give us the number of how many people are in self-isolation, or even the date the outbreak occurred?
Oh, the date that the outbreak is declared should be on the website. In terms of people that are potentially affected, there are a few dozen people that are potentially affected.
Okay, thank you.
Okay, so we've completed our first round of questions. Does anyone have any follow-ups that they'd like to ask? So I see, Tim, I'll start with you.
Dr. Wong, I was just curious about the team sports. Are there specific sports that you're more worried about when it comes to team sports, or is it just all of them all together?
Well, what we've seen across the province is, we've seen them in various settings. One of the sports that has come up more recently, because there's been a few outbreaks in this setting in Ottawa, are the other hockey team sports. So that's that's something, but we're reaching that's something to be aware of. But we're reaching out to all the local sports associations that we can reach, to remind them of, in general, the increased risk that we've seen in Ontario in these settings, and as I mentioned, oftentimes associated with activities that either happen before the game or after the game. And so, again, it's often related to social gatherings, and times when players, staff, families congregate together and are perhaps not as careful with physical distancing and masking. So that's basically why a lot of the group activities, situations where they could congregate, are really not recommended at this time. We want to keep the sports and activities as open as we can, because there are health benefits to that, and so we all have a part to play. All of us that could be involved in sports activities, the players, the coaches, the staff, the families. So I'm really asking everyone to please keep up those precautions before, during, and after play.
Thank you.
Okay, I'm seeing Nicole from CTV. Go ahead.
Are you, in regards to the place of worship, are you able to provide a date when that event was?
We're not going to provide specifics that could potentially identify people, and but the information that we are able to share, it should be on our dashboard. It should be the date that we've declared an outbreak. So I think information like that is important for case and contact management. And other than sharing the risks that we see that we believe people should be aware of in general, we won't reveal specifics in order to try and protect privacy.
Okay, thank you.
Are there any further questions? I think everyone's all set.
Okay.
So that concludes today's briefing. I wanted to note for you that next Tuesday is Regional Waterloo's Committee of the Whole meeting. And so we will not be having a briefing scheduled for next Tuesday. We expect our next scheduled briefing will be next Friday, October 30th. Thank you everyone for joining, and I hope